One of the growing problems in the U.S. is what is referred to as obstructive sleep apnea. Now there's also what is referred to as central sleep apnea, which is the result of dysfunctional changes within the brain signal that causes an irregular sleep pattern. However, I'm going to be focusing this discussion on obstructive sleep apnea that is the cause of over 90% of the cases of sleep apnea. Obstructive sleep apnea is a result of a mechanical obstruction to an individual's airway as a result of thickening of the neck due to weight gain. The key point that I need to make is the fact that researchers are now realizing that the underlying cause of this obstructive sleep apnea is insulin resistance. One of the key components that develops when you have insulin resistance, also called the metabolic syndrome or prediabetes, is the fact that you have a tremendous amount of central weight gain. However, what researchers and the medical community now realize is the fact that these individuals just don't gain weight around their middle, but also their entire trunk and up around their neck. Just observe someone who has significant central weight gain. You will quickly notice that they do have a large abdominal girth, but also that they have a large amount of fat around their chest which goes up into their neck. Well, this thickness in their neck actually causes a physical obstruction to their airway, especially when they're lying down. The main problem with a patient who has sleep apnea is the fact that they actually quit breathing during their sleep. These pauses in their breathing can last a few seconds to a minute or so, and may occur up to 30 times per hour. Even though snoring is a major complaint in these patients, the main concern is the fact that they quit breathing. This can result in high blood pressure, heart disease, cardiac arrhythmias or irregular heartbeats, and daytime fatigue. The usual treatment for obstructive sleep apnea is what is referred to as CPAP, or continuous positive airway pressure. This continuous positive pressure actually holds the airway open so that it does not collapse and stop their breathing. However, what you must be aware of is the fact that the reason this is happening is because these individuals have gained too much weight around their neck. So the question you should be asking yourself should be, if I lost some weight, could I improve or reverse this problem? A review article that appeared in the November 1st, 2014 issue of Family Practice News reported that there is a strong evidence that weight loss interventions can reduce sleep apnea and improve all the problems it causes. They conclude in this report that significant weight loss can definitely reduce your dependence for CPAP, or you could eliminate it altogether. Now just think about this for a minute. If you were suffering from obstructive sleep apnea and needed to hook up to a mask to put your CPAP machine on each and every night, wouldn't you want to know how you could possibly correct this underlying problem and get rid of this machine possibly altogether? In fact, most patients actually quit using their CPAP machines within 6 months because they are so uncomfortable and it's annoying anyway. They do this in spite of the fact that they know they are putting themselves and their health at risk. Wouldn't you think that you would be motivated to lose some weight? The truth is, the fact that most of them have tried to lose weight and have not been very successful. The primary reason is the fact that they are not able to correct the underlying problem, which is insulin resistance. You are not able to have success unless you firmly establish healthy lifestyles that actually improve insulin sensitivity. These are eating a healthy diet that contains those healthy, low glycemic carbohydrates, those good fats and good proteins, having a modest, consistent aerobic exercise program, and consuming nutritional supplementation, which are high quality, complete, and balanced. These all improve insulin sensitivity from a different mechanism, and when you combine them together, you give the individual the absolute best chance of losing this excessive weight and reversing this obstructive sleep apnea. You may also want to add some homeopathic drops that have been shown to accelerate this entire process.